Since the infamous World Health Organization Conference on Primary Health Care in 1978, community development has been promoted as a viable means to reduce inequities in health and to promote health globally. Community development is of interest to community health nursing practice because some of the essential components of such practice include primary health care, a population focus, and health promotion. Indeed, community development has been part of the historical development of community health nursing and is seen by many today as being integral to the practice. In this video program, the experiences of community health nurses and community members in the Green Bay area of the province of Newfoundland and Labrador will be used to examine the concept and principles of community development, its fit within community health nursing practice, and the outcomes and challenges of this process. The Green Bay area consists of 22 communities and has a total population of approximately 9,000 people. The town of Springdale is the hub of the area. First of all, what is community development? There are many definitions, but essential features can be delineated from them all. A key feature is the active participation of individuals, groups, or communities in identifying their health issues and concerns, then developing and implementing strategies to address them.
If a community health nurse is truly working from a community development approach, first of all, I think he or she has to value self-determination, like to believe that the client or the community has the right to define what their issues are and to, be part of the solution, and not just, has the right, but also believe that they do know what their issues are.
A second key feature of community development is that it focuses on developing capacity-building skills in order to effect change. In other words, it focuses on the strengths, assets, and resources that may exist within the community. In fact, in community development work, assets are often mapped, a process which develops and illustrates an inventory of assets to be used in improving the health of a community. Strengths can be related to community structures. For example, these include strengths in people, in the way that they work together, and in community facilities and services. Strengths can also be related to the determinants of health, which include social support networks, healthy physical environments, or individuals' personal health practices and coping skills. A focus on strengths is in contrast with a more traditional focus, which emphasizes deficits, needs, and an inventory of problems.
Community development is the process of identifying the strengths and resources and capacities of that particular community, and then organizing them in such a way that it benefits that particular community.
One of the things like with community development is you got to think outside the box, right? And if you look at it like in our society and within our systems, we label people based on their deficits, what their needs are, and that's how we identify people. Whereas you don't do that in a community development approach. You operate from a strengths base. So what you're doing, first of all, is you're identifying the strengths that individuals have and the strengths that communities have. So that's a big difference, like for traditionally the way we've looked at things as community health nurses. We're going to be a part of the team, but we're going to be equal partners. So we're not the person coming to the table now who has all the answers and expert driven. It's going to be identified by the community, and we're going to work with the community.
If they see what's good in their community, they oftentimes, it's the fuel that they need to make change. If they can see, that they have all this happening already, they may not look for outside help or resources because they see that they have a lot of this already happening in their community.
And it's no point, I don't think, in bringing in some stranger and trying to introduce some idea if the residents are not interested in it. And it's better for them to use what they have in their own community, the local stuff.
We can describe these two central themes in community development definitions as principles that the nurse can follow when working from a community development perspective. Community members participate in all stages of the process, and strengths and assets are resources to deal with the community's health issues. What other principles are key in a community development approach?
Sometimes when you're working, you have an idea and you want to run with it and this sort of thing, but there has to be community readiness in order for anything to happen in community development, and that the communities are mobilized from within. Sometimes we talk about mobilizing communities, but we can create an environment that will support mobilization, but communities have to be mobilized from within.
You need to work with your community, see the community members as being the experts in their community. You need to, look at all members as being equal, bring them in as being, everybody has a voice.
A true community development approach would definitely be beneficial to the hard-to-reach or marginalized groups because, well, number one, if you look at a value of community development is social justice. So obviously you're operating right from the beginning of the premise that you want the input from these people. If you look at collaboration in community development, like who you collaborate with can be so broad because quite often it's going to depend on what particular issue you're working on at the time. We've collaborated with Human Resources, Labour and Employment. We've collaborated with Service Canada. We've collaborated with municipalities, churches, service groups, apart from the regular primary health care providers that you would be collaborating with. Like these are some of the community groups, and you have to.
If you include members from the beginning of what your goal is, oftentimes they feel empowered and develop confidence and skills, and that helps them feel confident in their abilities and also helps with sustainability.
Some other principles are that the relationship between the community and nurse is one of partnership, that communities need ongoing support as they engage in community development work, that health is seen in a broad context, often connecting health issues to the determinants of health, identifying the issue behind the issue, so to speak, that interventions are guided by what the community members perceive to be their needs and priorities and must be acceptable to them, that the focus is on local concerns, so the process can vary from community to community, and flexibility is needed on the part of the nurse and the community members. That process outcomes are just as important as end result outcomes. For example, building leadership skills is as important as the fact that more community members are now engaged in physical exercise on a regular basis. And finally, that open communication between all partners is essential throughout the process. Now that I have described the concept and principles of community development, it is time to move on to how the process works. If you reflect on the principles just described, you can surmise that the process is not always the same. This is illustrated by the following descriptions of what happened in different communities in the Green Bay area.
We're responsible for 22 communities. So one of our communities in Roberts Arm, like a group of parents came together and they recognized that there was a need in their community for some programs, some social programs, for families and young children up to school age. So these communities, these mothers came together, they mobilized themselves. They recognized that, so what they did, they gathered the group, they, pointed out to people that this was an issue in their community. They talked about what they should do about it. They went to the town, they utilized the resources that was already there in their community. They got the support for the building. They did what would you call it? They went around door to door getting toys. They got some funding through the local bingo in their community to buy some toys. So they started. Then after they were going for a while, they realized okay, we need more expertise here. And so then they approached a community health nurse, and then that was when I got involved with them. The process that happened in Springdale around that same issue was different because in my role as a community health nurse, I was the catalyst who brought that group together. I mobilized people, got them together, discussing it, and came up with a plan. In that group there was parents, there was